But now that some nurses and some first responders are resisting the vaccine mandates, it becomes clear that those emotional words meant nothing. Now that healthcare workers threaten the left's COVID power grab, they've gone from frontline heroes to public health menaces. Those same workers are now being terminated from coast to coast for opting out of vaccine requirements. Across the country, we see healthcare staff being forced to choose between taking a vaccine they don't want or being fired from the jobs they love. Many report having antibodies to the virus due to past exposure. Oftentimes they got it in the hospital. Others are young and fit, and they don't feel like they need the vaccine. These are people who are in hospitals every day, so you can't say they haven't seen the pandemic up closer. They don't understand the risks. Of course they do. The point is, they've experienced it firsthand and have chosen to forego the vaccination for a variety of reasons.
Our entire lives, this is how we've practiced our profession. And now we have this mandate that's come through, and the first thing we're going to do is question, okay, does this make sense?
You can see the data, the statistics alone of the survival rate for me. The risk of the vaccine was more concerning to me than getting the virus.
Well, and now the staffing shortages due to the mandates are getting worse by the day. In Texas, there's a crippling nursing shortage driven in part by the decisions of hospitals like Houston Methodist that fired unvaccinated workers. Then in upstate New York, hospitals are in a bind too. In Erie County Medical Center in Buffalo, roughly 400 people are unvaccinated and on leave. We stopped elective inpatient surgeries. We stopped some of our outpatient visits. We stopped ICU medical transfers, said President and CEO Tom Quattroche. New York State's largest healthcare provider, Northwell Health, has already fired about 24 of its managers. The North Carolina-based provider Novant Health fired almost 200 employees. Now, think about the insanity of this for a moment. The politicians and the public health officials who ordered us, begged us to stay home, to wear masks, to cancel church, sports, forego weddings, all the other things you like to do, in order to save the healthcare system, they're now the ones actively sabotaging the healthcare system. Kind of makes you think this wasn't about saving the hospitals right from the outset, was it? Of course, we now know that when they say the hospitals, though, are being overwhelmed, it's almost always a lie. With the exception of a few big city hospitals in the U.S., our hospital system was stretched for sure, but it was never overwhelmed. And with the Delta variant, any hospitals that were stretched usually found themselves in that situation due to staffing shortages created by their stupid vaccine mandates. We know the vaccines help avoid serious illness. We all know that. But we also know that fully vaxxed people can still test positive for COVID months later. They can still get sick, albeit not as sick, and they can still spread the virus. In other words, fully vaxxed hospital workers can still potentially spread COVID to others. But at least they won't be fired. Of course, all these hospital associations smash their own credibility in not recognizing natural immunity among staff. Now, how is it that state medical boards don't recognize established immunology on this? It makes no sense. The madness continues also to this day, and people from all walks of life, from all races and ethnicities, are saying no. Another anti-mandate protest popped up in Manhattan yesterday. Do those people look like a bunch of uninformed Trump supporters to you? Now, one of the most revealing government actions taken during this entire COVID nightmare came just days ago from New York Governor Kathy Hochul. After her state's idiotic mandate created the healthcare worker shortage, she then responds by assuming more emergency power. Why not? And then she orders foreign workers to replace her own constituents.
This is a conversation we've already been having to talk about the opportunity we might have in freeing up the visa system to have some temporary workers come from places like the Philippines, where many nurses go elsewhere.
And to add add insult to injury, the unvaxxed workers would also be ineligible for unemployment benefits. They love those healthcare workers, though, right? Illegal immigrants who just cross the border, they get treated better than lifelong New York residents. This replacement worker scenario, though, is perfect for liberals who are always more than happy to import foreign labor. They love that. Now, vaccine mandates in healthcare and policing, fire departments, they're just the latest example of government officials getting their pandemic response wrong, with the effects hurting the working class people hardest. All these mandates, from the lockdowns to the vaccines, were meant to protect us. But now we know that they were doing all of it all along was trying to protect their own power. Now, remember what these geniuses were saying about packed college football stadiums just a few weeks ago?
There's lots of shouting going on, a lot of virus getting into the air.
I just can't get over the pictures of those outdoor stadiums.
I would be very surprised if we didn't have outbreaks here and there across the country related to these gatherings.
Always wrong, but never in doubt. None of it panned out. I actually think those doomsdayers are disappointed that there's been no spread from college football. The same would occur, of course, if hospitals left their workers to make their own decisions and trusted their own medical judgment. But that would mean states lose some of their own control.